Hello and welcome to the Talk with Tariro, where today on the program we are looking at the issue of COVID-19. As a country, when we are looking at the steady increase in terms of COVID-19 that we are witnessing, there's a lot of talk, are we in a third wave? Are we getting into a third wave? And there is a lot of emphasis in terms of us making sure that we are vigilant, and the vigilance is to do with us following up on the COVID-19 protocols, that's masking up, sanitizing, washing our hands, maintaining the physical social distance. Today on the program we have Dr. Tariro, who is going to unpack COVID-19. When we are looking at it, we do know as a country there's still a lot of confusion that we have. So on the talk today, we just decided let's just go on to the basics and talk all things COVID-19, from prevention until the vaccination, what we need to know. Dr. Duri, welcome to the talk.
Thank you very much.
Yes. When we're talking about COVID-19, a lot of people are saying, what exactly is this? Where did this thing come from? What exactly is it?
Thank you very much. Those are very good questions that you've asked. So COVID-19 was first discovered in China, and when in Wuhan province, and we then had it happening there, and it was then reported in Zimbabwe in March 2020, and that's when we had our first case of COVID-19.
Yes.
And ever since, it is spread to the whole of the world. So it's now called a pandemic. So every country is being affected in one way or another. So that's where basically how we got the COVID-19.
Yes. And we have a lot of people saying it was manufactured, it was what? And when we talk to medical practitioners, they always laugh at us. And I would want you to really say, when we say we have something like COVID-19, now it's a pandemic, how do these things generate, like these viruses?
Yes, you are talking to one of the medical practitioners. I will also laugh at you. There are lots of conspiracy theories.
Yes.
There is people who think that it was manufactured and it was meant to destroy a certain group of people. But look, these remain just stories that people come up. We are scientists and we are guided by science. We know that it's a virus, and it's one of those viruses that we've experienced, and we know that the way it's behaving is typical of most of the viruses.
Yeah, I like what the doc said. These are just conspiracy theories, and I think the earlier we just accept that this is a virus and let science lead. As a country, as a nation, as human beings, we will progress well when it comes to ways of how we are going to deal with this pandemic. And Doc, for us to address COVID-19, one thing that we need to work on is the issue of prevention. Could you shed more light to us as a nation in terms of the prevention protocols that we need to follow?
Okay. Thank you very much. I think you alluded to some of them in your preamble, where you're saying that we need to physically distance each other, at least a meter away from each other. We also now know that, putting a mask is very paramount, like I am doing. So if we do put on masks, it does prevent the transmission greatly. Whereas too, when both the people who are talking to each other have got masks.
Yes.
And we know that washing of our hands prevents that virus which is in our hands going to ourselves. And also we are encouraged to make sure that we don't touch our faces, and make sure that you wash your hands, you sanitize, you avoid crowds, because the more people are crowded together, the more the risk of us transmitting to each other. So in our Zimbabwean situation, funerals, gatherings, cinemas, and closed doors, this is where the risk of getting COVID increases. So one is best informed to try and to avoid such gatherings. And I think in their wisdom, the people that are leading this pandemic, control of this pandemic, have now said, look, let's reduce the numbers to 50. For funerals, they've said 30. And it is with that thinking that, there is the transmission of the disease becomes increased when people at, in crowded places.
Yeah, I do know, Doc. We talk about, especially for funerals, for gatherings where we say 50 and 30, and for funerals, it's really becoming a struggle for Zimbabweans. You say 30, but people are still going to funerals. People, you find maybe you're the one who's got a funeral within your home. People are coming. How do we get to a situation where, as a country, we actually get to accept that this is a new normal? We are not in a normal environment. And if we are saying 30 people, it has to be 30, because adherence on that, it's a bit difficult from what I've noticed.
It is definitely difficult. It's not within our usual normal.
Yes.
This is the new normal. In as much as we love each other, there's a risk that we can all perish as a family if we don't stick to those. So we need to embrace this new normal. It's unfortunate, but really, if we do love our relatives, we do them more by avoiding the number above 30, because the risk increases when we are a crowd more than that.
Yes, and our usual way of mourning or sympathizing is the shaking of hands. In Shona, we call it kunobata maoko, which means when I get there, ndichabata ruoko rwemunhu.
Yes.
That practice as well, and even hugging someone when I'm crying, still for funerals, because for me, they are one of our super spreaders in the country. So I would want you to emphasize more, Doc, in some of the ways that we do it, even when we are 30, the do's and don'ts at a funeral.
Yes. I agree with you. Funerals are super spreaders. We know that most of the people that we had attended funerals in the first and second wave. And I agree with you that there is need for us to change our behavior. You don't necessarily have to hug somebody.
Yes.
The fact that you are present is good enough. But what we encourage, if you really want to greet somebody, you can use your elbow, okay, you can use your fist, something like that. But try and not have contact with those people in terms of hugs and shaking hands. So this is a new normal, and we have to change the way we do. Yes.
Indeed, this is a new normal. We need to change the way, our usual way of doing things, like what Dr. Duri is saying. Things are actually different. We are seeing a steady increase in cases, and we do not want to get to where we were beginning of this year. Doc, when we are looking at COVID-19, who is more prone to being infected?
So what we have seen is that men are more at risk of getting the COVID.
Men?
According to our statistics. And we know that there are people with comorbidities that are likely to get them. We know that people who had diabetes mellitus were at more risk of dying of COVID disease than others, and other people, they are also at risk. But I need to say that should somebody have a well-controlled condition, then the risk becomes much less.
Yes.
Yes.
Let's focus on HIV. I'm HIV positive. Am I prone to COVID-19, or it's only when my immune system is compromised?
Let me hasten to say everybody is at risk. I think the question you want to ask is, am I at a higher risk because I'm HIV positive? If I am HIV positive and I am well controlled, the risk of getting COVID remains the same as anybody else. So there is no added risk of you as being HIV positive. So positivity does not necessarily put you at a higher risk of getting the COVID disease.
Okay, that's the doctor unpacking those key questions that we normally have. So the risk when it comes to COVID-19 infection is everyone, we're all at risk. Who is more prone? When you have got the comorbidities that he spoke about, then you are at a greater risk. You are more prone to be getting COVID-19. And usually for people living with HIV, we often raise it. And he's saying if your HIV is controlled, your viral load is 0, you're on your ARVs, then your risk is the same as everyone else. Join us after the break as we continue with Dr. Duri unpacking all issues COVID-19. Welcome back. We continue with our discussion where today we decided to unpack all those questions that you normally have to do with COVID-19. We do know there are so many conspiracies, and for us as a country, when there is something that is negative to talk about COVID-19, particularly with the advent of social media, those are the things that we want to spread. Somebody who's just saying anything to say about to spread fear and we are so quick. So our message always is to say, when you have not verified any information, try not to share it. What are we benefiting by that sharing false information, by causing alarm through those messages that we are sending out? We only want messages that are beneficial to us as a populace. Doc, as we continue, when we're looking at the issues of the signs and symptoms that I would say, maybe I need to go to the hospital, I might have COVID-19. What are the signs and symptoms that I need to look out for?
Okay. So we know that patients who have COVID tend to present with issue of cough, headache, they've got aches and pains, they can present with sore throat, in some occasions with the diarrhea, but they just have got very non-specific conditions. But the fact that you have got a sore throat, you've got a headache, you've got a fever, abdominal pain, and you cannot smell food, that in itself should increase your suspicion of having COVID. And of course, you also need to have a history which is suggestive of having had contact with somebody who had COVID-19.
Yes. And the question that many people have is how I distinguish between like a normal cough where I've got flu, I've got a cough, and COVID-19. So currently, if I've got a cough, should I get worried, or there is something that I can distinguish? Even the headache that you are talking about, it's all those things that we used to experience. But now, when it comes to COVID-19, where do I start putting question marks?
Yes. So this is what I'm saying. You need to put it in context. So the fact that you have got the flu-like symptoms in this era of COVID should raise suspicion that this could be COVID. Okay, so you become highly suspicious of that. Worse too, when it's compounded with a history of you having contact with somebody with the COVID. That then even gives you the high index of suspicion to say this is likely to be COVID. Yes.
And Doc, let's now move on to where one of us within the home has got COVID-19.
Yes.
In terms of management, how best can we handle it?
Okay. So the issue which is there is what is it that you do at a household level?
Yes.
And what is it that you do should you find that somebody has symptoms suggestive of COVID-19? So the first thing is that, yes, you suspect, you go to your doctor, they go and examine you, or to any health facility where they then examine you, you'll have a test which will confirm. In the event that it has been confirmed that you have got COVID-19, we recommend that if you have got symptoms that are not severe, so we've got mild, moderate, and severe cases. So you are saying that if somebody has got difficulty in breathing, they cannot complete a sentence while they're talking, and they're coughing, they probably need to be within a hospital setup. So they'll do oxygen saturation, it will be high. In the household level, let's say you've got mild symptoms, what we would want you to do is to isolate yourself. Be in your own place, find somebody who can then bring food to you, make sure the windows are open, make sure that you practice a hygiene of highest order. You want to make sure that you sanitize, you don't share blankets with anybody, your utensils. You are isolated. The whole reason of us doing that is that we want to reduce the spread of the disease to your loved ones. And you try and give at least a minimum of 1 meter distance to have come in contact with.
Doc, I do know you have got an appreciation of our own situation in terms of our living environments, where people were saying, when we are talking about, the need not to overcrowd, and or sometimes those are not homegrown solutions, because we are within the home and the house is divided by curtains. Within that home, it's me, my husband, the children, it's the 5 of us or 7 sometimes in one room. How do we deal with that? within our own African or Zimbabwean context, to be specific?
So what we have, the beauty of it is that we in their wisdom, the Minister of Health, in conjunction with other arms of government,
Yes.
have come up with a quarantine facilities where people who cannot isolate themselves, like who don't have good isolation facilities, they go to quarantine centers where they are then put for a period of time under observation, and they are managed from that setup. But in the likely event where people have got good isolation facilities, then people can isolate at home.
Yes.
But we've got people who are trained to assess the issue of suitability for isolation or not. Yes.
And where we have mild, as a country, I think we came up with our own treatment protocols where steaming, zumbani, we had our own alternative modes. And then when we come to you as the doctors, you are saying these things don't work. Do those work? And now I'm putting you on the spot.
You are putting me on the spot. I think I'm best trained to speak on things that I'm trained to do. But I know that there are things that do work out there. If it does make a difference, you are encouraged to continue doing it.
Doc, steaming, does it work?
I'm not sure actually, because I have not steamed myself.
You have not steamed yourself?
Because I think you need to remember that we are scientists.
Yes.
And we are guided by science.
Yes.
We will then need to do a study where we are saying those that don't steam and those that steam, who had the best benefit. So without doing that, I cannot then give you a conclusive answer. Thank you.
Okay, thank you very much, Doc. We'll continue with our discussion after the break. We do know when we started witnessing those increases in COVID-19 cases, we started again our steaming regimens. And really, when you speak to any medical practitioner, they've refused to confirm, and Dr. Duri has just done the same as well. So I'm not sure what we need to continue doing and all those teas that we were taking. But he's saying if it makes you feel better, then you can continue. But for him as a doctor, they've got no comment. Join us after the break. Welcome back. Our discussion continues. Doc, when we are looking at COVID-19 and people living with HIV, from the cases that you were witnessing, would you say that are significant numbers that you have witnessed for people who are living with HIV as well as having TB? Particularly, we know with TB, their breathing issues. How is the situation?
Okay. So what we have said, like I have said in the past, previously, is that if a patient is well controlled, the risk becomes less. But we know that when somebody has got co-infections and they've got active disease, especially where respiratory condition is concerned, then they are likely not to do so well. But we know that with good management, some people do well. So really, it's an issue of saying when the COVID does take effect, when are you in a state where you are in good health or not? If you are not in good health, then the risk is very high. Yes.
And we know as a country, Doc, we are rolling out vaccines, the vaccination program, and we have a number of people who are actually skeptical with a number of conspiracy theories. Maybe explain to us how vaccines work.
Okay. Thank you very much. So vaccine, the whole concept of vaccination is that you give somebody a mild form of the antigen, and it's supposed to stimulate antibodies. In the event that you...
Antigen is what, Doc? So, what are you giving me? Because are you giving me COVID?
No, I'm not giving you COVID. I am giving you a strain of the virus, which then goes and stimulates your immune system. You then produce what are called antibodies. These are the things that fight infection.
Mm-hmm.
So the body remembers that this came before,
Mm-hmm.
and then they fight the infection, and that way you get protection.
Mm-hmm.
When the disease come, it's attenuated. It's not as virulent as it would have done without protection, without
Yes.
that protection.
Mm-hmm.
So we do have vaccines,
Mm-hmm.
and in Zimbabwe we've got about 3, if not 4, vaccines that have been approved.
Yes.
And it is a very important tool where we are saying that where countries have conducted studies, people who have received the COVID vaccination have been shown to actually improve, to actually have better outcomes when they get the disease. So there is a lot of benefit in getting the vaccination. I need not say one of the reasons why Zimbabwe is doing very well is because we are leading in terms of numbers of people who are vaccinated. You should see the chaos that's in those countries where people have not received the vaccination. Yes.
Yeah, and when we're looking at this COVID-19 vaccination, there's a lot of confusion in terms of who is eligible. Oh, we've got people like people who are pregnant, we've got breastfeeding mothers, and people with terminal illnesses, and then the elderly as well, who are even saying, should I even be vaccinated? So when we're looking at this, who is eligible?
Okay, fine, good. So you would see that eligibility is to try and reduce the effect of the disease. So we know very well the groups that were at risk when we had first and second wave.
Yes.
So your diabetics, your elderly, and other groups were at risk of getting those. So these are the people that you want to vaccinate.
Yes.
So that they remember, the body remembers that there's this thing called yes. So the people that are supposed to get, in most countries, you find that these people who have got comorbidities, who are elderly and things like that. So you find that the younger group of people tend not to have the risk is much less in terms of disease profile. Coming back to breastfeeding mothers and pregnant women.
Yes.
All the people who have manufactured these vaccines have not given literature to say that it is safe or not safe to give pregnant mothers or breastfeeding mothers. It's still a gray area. There are current studies that are happening where people are trying to explore to see whether it is beneficial or not. So as we speak, we'll then go by what is in the package insert of the vaccines by the manufacturers. Thank you.
So as is somebody actually who is breastfeeding asked me to then come to you and say, should they go for vaccination? They would want to go because there is no information. So is it safe for them not to vaccinate, or they should go and vaccinate?
Then what the doctor is supposed to do is to explain to them that you give them information so that they make an informed decision. Yes. So what you do as a practitioner is to give information, and a decision after information has been given is then made.
Okay.
Yes.
All right. And when we are looking at people with HIV and are on ARVs, somebody who's diabetic is on insulin, I'm on TB treatment, issues of drug interaction and vaccines, is there anything that has been looked at scientifically, or we can conclude it's safe?
So when we remember, we've got phase 2. When a vaccine is put on the market, it goes through certain levels. Currently, most of the vaccines have gone through phase 3 clinical trial, and the evidence has not shown that there are drug interactions with the vaccines. That, to my knowledge, has not been very elucidated, and I want to believe that there is no drug interaction with the vaccines for both ART and anti-TB drugs.
Okay. And what would be your final message to Zimbabweans, particularly when we are looking at the issue of COVID-19? We know we are already in winter, and cold seasons being COVID-19 friendly, and just us in terms of embracing the vaccination program, as well as making sure we maintain our COVID-19 protocols. Your last message to us as a nation.
Let's embrace the issue of the vaccinations. Let's try and heed what the health personnel is telling us about social distancing, masking up, behaving ourselves, please remember to put on your mask. For me, it is very important to put on your mask. It does reduce the transmission and make sure that you don't touch your face.
Yes.
Yes, avoid the crowds. And I'm sure the Almighty will look after us. Yes.
Definitely, we are hoping and we do trust that the Almighty will continue protecting us as a country. It's heartening to see that even in terms of CDC, they have moved us from level 4 to almost level 1 or level 2, where we are now not much of a risk in terms of COVID-19. And it's kudos to us as a nation. We have tried our best to make sure that we are protected when it comes to vaccination rollout. We have also done extremely well, and we do know, like now, the Vice President, who's also the Minister of Health, has put in protocols to make sure that we continue, particularly decongesting offices, some geographical areas. I do know Kariba, Karoi, isolated lockdowns are being in those areas. Let's all make sure we continue observing those protocols, and like what the doctor said, mask up, sanitize, maintain social distance. Until next week, it's goodbye.